Hello, conversationally family, friends, and guests. We're so glad to have you here for our first ever live stream event. Today, we are having a panel discussion on Black women and lymphedema, and we know it's going to be great. And if you'd like to participate, please leave a comment on Facebook. And if you're watching on Facebook, and we'll try and answer your questions as we go if we can. Now, for those of you who may not know me, my name is Bisa Dobson. I'm one half of the conversationally team. I'm also a lymphedema thriver, a primary lymphedema, and I'm also a lymphedema therapist here in Toronto where I live. And the reason why we decided to do this panel discussion today, because we think it's an important discussion, and we are trying to elevate the voices of people who are not often heard in our community, and we're starting with Black women, but no, there are going to be lots of other discussions and in this series that will allow all kinds of people from all walks of life to be heard and seen, and it will be as inclusive as possible. So now, without further ado, I'm going to add all the guests to the live stream and introduce them one by one. So welcome, Chronically Money. This is Monique, everyone. I'm just going to do a quick introduction. She is a primary lymphedema thriver. She's had lymphedema since the age of 12, and because of improper care, her legs got quite large, and she decided to have 8 debunking surgeries to correct that situation. And now she is living her best life and out here doing her best to promote a message of self-love and spreading awareness and knowledge about lymphedema as she goes. Welcome, Moni. All right. Next is Angelique Charles, also known as the Lippy Butterfly. She is mostly on Facebook, newer to Instagram, and she's a lipolipedema thriver. It took her a very long while to get diagnosed properly, and over the course of that time, she ended up dealing with mobility issues. But now, again, she's also living her best life and out here trying to spread awareness, learn as much as she can, and also connect with our community. Welcome, Angelique. All right. Next up, we have Dania.
Yeah.
on. She is a live Hey. And she was moved from years at the lymphedema, and she's also next row. And finally, we have 2 more people actually. We have Berlange Presilus. Hello, Berlange. She is one of our mystery guests today, and she is KPS, Klippel-Trenaunay syndrome thriver, and also lymphedema thriver, and she is joining us today. We're so glad to have her. And Berlange is a spokesmodel, an entrepreneur, and an advocate, and someone who's really Thank you. She's somebody who's really focused on making sure that people are feeling good about themselves and comfortable in their own skin. So welcome, Berlange. And finally, we're going to add Dr. Alexea Gaffney to the stream. She is a doctor who, in the United States, who is also a lymphedema thriver, a breast cancer thriver, a mother, a coach, a live speaker, and what she is doing is hoping to help people heal and transform as she heals and transforms herself. So welcome everyone to our live event. We're so glad to have you all here. Okay, so first person we're going to ask the question to is Dania. And what was the challenge you faced when you were diagnosed?
The greatest challenge for me, well, firstly, hi everyone. The greatest challenge for me is basically clothes and shoes, and just being able to dress comfortably and appropriately for the occasion, really, and also basically being able to put my best foot forward. So that's one of my major challenges, and also just being accepted by everyone, really.
Dania answer, so anyone who wants to jump in can answer as well. What was your biggest challenge in getting a diagnosis of lymphedema, and also what is your biggest challenge now in your lymphedema journey?
I had a really long journey in trying to get a diagnosis with lymphedema. The symptoms, even asking my mom, they were showing up in me. As far as a toddler, she was asking the doctors why the formations in my legs looked so odd. But around about 25 is when I started to get the pain, and the fibrotic tissue started to develop from the lymphedema portion of it. And even at that, I was going to doctors and asking them, sometimes specifically, is this lymphedema? And some of them had said things like, because it was on both sides, it couldn't be lymphedema. Because I didn't have any form of trauma that they could date it back to, that it couldn't be lymphedema. And at the time, I didn't even know about lipedema. I had been researching why my legs had gotten so large, and that's what kind of kept coming up. It even took another 5 years to actually get a diagnosis of lymphedema after that. And I think that it kind of had to do with my size. A lot of times the doctors just decided, because of my size, my legs were larger just because of that, and it was obesity. I had to go through getting weight loss surgery, and the problem still persisting until someone finally said, okay, yeah, this is lymphedema.
Wow, that is so common for all of us. I think we know in the community, people talk about the long journeys to getting diagnosed and being misdiagnosed or underdiagnosed, not getting the care they need, so their condition gets way worse before they get any treatment. Would anybody else like to answer that question?
Sure. Hi, everyone. I got diagnosed when I was 12. I went ice skating, sprained my right ankle, walked on it like a G, and I was just doing me. And it was my mom, who's a nurse, a registered nurse, who noticed the swelling in my leg before I did, and I had pitting in my foot. So that started our journey, and it took about 6-7 months of me going to 6 different hospitals across the state of New York, emergency rooms, CAT scans, MRIs, blood tests, all of it before I was diagnosed. And it was actually a resident in the hospital to one of the emergency rooms that we went to, like, I think it might be something called lymphedema. You might want to check that out. And then we found Lerner Lymphedema Clinic there in New York at the time. And so that's where I got my diagnosis. So, and then by that point, my left leg started swelling as well. So,
okay. Yeah. Oh, wait. And in your case, does it run in your family since it went from one?
So that's the odd thing. No, but now, yes. I think one of my older cousins actually was recently diagnosed with lymphedema. She's always had thick legs, but she's a hairdresser. So she's worked on her legs her whole adult life. And so she started developing vein issues and then swelling. And then she just probably within the last 4 or 5 months got diagnosed with lymphedema. Okay. So, yeah.
Okay. So moving on to another question that is tied into this one. I'm going to pose this one to Berlange. So how did your diagnosis, your condition, impact your body image and perception of self as a child? And how have you overcome that as an adult and with what you know now?
Hi, everyone. Again, my name is Berlange. In my case, it's a bit different. I was not necessarily born with lymphedema. I developed lymphedema. I've seen over 50 doctors in the US and both in Canada as well. It wasn't until I was in my 20s, I traveled to Cuba. Actually, I heard there's many great doctors there. And because I tried all my sources and I was running out of luck, I decided to take a chance to go to Cuba. It was there. But when I was in the US, I did have 2 surgeries in which then I developed lymphedema. Some of you may know that I am a fashion model, and being in the fashion industry, that was my biggest fear, not being accepted. I hid myself a lot, since you all know it's all about beauty, body image, perfection. And I was bullied in school, all because I didn't know what was happening. I didn't know what my condition was. And Clippertonane, which I was born with, is very rare. 1 out of 100 people are affected by it, and I happen to be one of the lucky ones. So that I thought the whole time I was just different. I didn't know what was happening until it was after I got diagnosed with Clippertonane, and then I was told I also have lymphedema, which happened after my surgery. And when it comes to body image, again, I hit a lot because I didn't know. It was recently I found a community online when I started to, on my truth, speak about it, and which I became an advocate for Clipotronane. And then I started to find my tribe in both communities, Clipotronane and Lymphedema. And I decided to just continue speaking, raising awareness. But it was really tough growing up. Even now, I avoid going to the doctors because it's always, they don't understand what's happening with my leg. They barely can help. So whatever when I do research, I find out online, like some of you ladies says, I find out what you guys say, what you type, and I started doing them, wearing my compression stockings, doing aqua therapy, but I've never really been able to get proper care for my lymphedema or Clipotronane. So I've been just managing the best way I can.
All right, thank you. Dr. Alexea, we haven't heard from you yet, so how about you come on? I know you didn't acquire lymphedema as a child, but we'd love to hear about your journey and how you come to body acceptance as well. Thank you.
Sure. So I developed lymphedema as a result of having bilateral mastectomy. So I had both of my breasts removed as part of my breast cancer treatment. And on my right side,
What do we lose her?
which is affected, have lymphedema in both of my arms. But I had a complete lymph node dissection in the right armpit because those lymph nodes were affected by my breast cancer. Pretty immediately after my surgery, I started developing pain and tightness in my arm on the right side, but they said it was too premature to diagnose me with lymphedema. But I did have the benefit of getting an immediate referral to a lymphedema therapist just because I had had the surgery and the risk was known. Had garments though until I had radiation therapy, and that completely exacerbated the whole thing. And it's a daily challenge. You know, I should be in a sleeve or a garment 24/7. I have to wear gloves, which is impossible. I'm an infectious disease doctor. I wash my hands somewhere between 50 and 100 plus times a day, depending on how many patients I'm encountering. And the risk of infection is a huge issue because I'm having to touch my patients, you know, address open wounds and drug resistant infections. I'm a mother, you know, I have 2 dogs. And so everything poses a risk to my arm. So I go through life protecting my hands. You know, we talk about self-acceptance and body image. I've always had arms that were a little bigger for my body habitus. So wearing a shirt with a sleeve was something I wasn't able to achieve, like wearing a nice button-up blouse, until I lost all of this weight in trying to prevent my mobility. So I get stuck in clothes a lot. There's a lot of clothes that I just simply cannot wear. Most of my shirts, tops, dresses are sleeveless or have big puffy sleeves, and that plays a huge role in, you know, my level of confidence, how I feel when I have to get up on a stage or get in front of a computer screen to speak, because, you know, we make our clothes, but if our clothes don't fit the way they used to, or, you know, you're preparing to give a talk, and you're the motivational speaker, you're the inspiration on the stage, and that dress that you always feel, you know, good and bomb and, you know, powerful in, all of a sudden you can't get it over your sleeve or up over your arm, or your lymphedema garment can't pair with it, or, you know, for me, because of now I have artificial breasts, the way that looks, it's a whole big thing. And so, you know, working on my mental and emotional health and well-being, working on self-confidence has been a huge issue, but I've been able to tackle less in a daily struggle sometimes. And I think a lot of people just don't consider the things we go through as lymphedema thrivers.
Right. Thank you so much for this. Ties into the next question I want to ask you, and then the whole room can answer as well. So I wanted to ask, because so much has happened in 2020 and 2021. The pandemic, all kinds of issues around equity, Black Lives Matter, now here in Canada, and I think abroad, residential schools. There's so much in the ether that's a lot to deal with. Emotionally, job, the way we work is changing, family life is changing, everything. So I wanted to ask you, Dr. Gaffney, you touched on it a bit. What are you doing to ensure that you're taking care of your mental, emotional, and physical self the best way you can? What are you doing for self-care that you think might be helpful as a tip for other people here online with us today?
So one of the things that I'm clear on and that I recognize both as a physician, a patient, someone who is, on the high risk list for COVID-19 complications, and as a woman of color who is more likely to get disparate healthcare when I enter into a healthcare system for any reason, more likely to not be taken seriously, even when I'm walking in and being taken care of, people who are my colleagues. I think it's so wholly important and so critical for us as Black women to make sure that we are doing everything that we can to prevent illness, so that, God forbid, if we encounter COVID or we're facing some other physical health condition, or if we even dealing with an issue that is a complication of the lymphedema, such as an infection, that our bodies are in the best shape in order to be able to combat or fight infection, illness, or some sort of complication. So as far as my self-care, internet self-care, it is not salons and bubble baths and manicures and pedicures. It is making sure I drink enough water, making sure I eat enough fresh fruits and vegetables, minimizing the stress in my life. Because even when I'm stressed, it causes exacerbations of my lymphedema, because now I have all my muscles all tense, my posture is terrible, I'm clenching my jaw, I'm doing things that limit my deep breathing, I'm doing things that inhibit circulation, I'm not moving because I'm frozen in place because I'm stressed and aggravated. So making sure I'm just stretching, taking deep breaths, getting adequate exercise, using nutritional supplements, and in terms of supplementing a healthy diet and a healthy lifestyle, making sure I do my lymphatic massage every day and in every free moment that I think about it. So sometimes, I'm hearing about a patient I'm going in to see, and I got my arm up in the air and I'm doing my massage. And, I have learned to release, the concern about what every day is about, what I have to do that serves my best interests, even down to working. Income is important, education is important, our level of success is important, our health is our greatest wealth. And so I have even sacrificed income in order to be able to make sure that I am taking the best care of me that I possibly can. Because I know that if I'm hydrated, I'm rested, I'm minimizing stress, I'm well nourished, and I'm exercising and moving my body and taking care of my mental health and my spirit, I'm going to COVID-19, hospitalization from other things, cancer, all of those things. And I think we kind of forget that that's really where it's at. It's a lot of things, but if it just becomes our way of being and living and existing in this world, we're really setting ourselves up for better health and for wellness.
Awesome. Okay. Anybody else have anything to add around the self-care piece? And also, I think I want to deep dive a little more into the whole shame body image aspect. I think that's something that everybody was nodding their heads fierce at that point. So if there's anything about self-care around that piece, I'd love to hear from anyone who wants to speak to that as well. Do I need to pick somebody? I'm going to volunteer.
Hey, no, so,
Monique, go ahead.
So I was drinking, y'all. Okay. I was hitting that bottle hard during the COVIDs. Okay. I didn't realize how much I was drinking until I watched Red Table Talk, and it was like, you're supposed to drink. I was like, oh, my bad. But I actually addressed that earlier this year because I did have weight loss surgery to help with my lymphedema. Because when I was diagnosed, I was 12. I was athletic. I was on a team, marching band, track, did everything. So I was very athletic and built. When my leg size started growing, it was really visible for me. But for me, I had to learn to give myself grace throughout this time. And it's okay to start over, because I was, okay, I'm going to work out. I'm drinking my water. I got my little hydrate bottle with the app to notify me when I'm drinking water and all this kind of stuff. And then like 2 weeks later, I'm like, ooh, I didn't do that. So just giving myself grace to start over. I know what I'm supposed to do, just doing it and taking it one step at a time. Because for me, stress manifests itself in cellulitis. the doctors were trying to tell me it doesn't make any sense, but I promise you, every midterm final I had in college, I had cellulitis to the point where I was going to the hospital, So for me, really managing my stress level throughout this time was key to not getting sick overall. As far as my body image, I used to be very, very scared and shy to show my legs. I didn't like stares and people coming up to me, or I didn't even like people asking questions. I just wanted them to like imagine me normal and just keep it moving. But now I really have a like, I don't care attitude about it. I go out the house in my basketball shorts with my wraps on or my stockings on. I'm starting to get to the point where I'm starting to buy midi dresses. You're just gonna have to see these trunks hanging out from below because it's cute. Because I'm not gonna, I just refuse to keep limiting myself based on other people's view of what's beautiful, what's sexy, I'm sexy. These legs do what they do. I'm blessed that they carry me where I need to go. I can put some shoes on. They might not be the cutest high heel shoes. Can't wear those, but they do what they do. And I'm blessed to have them big or small. So, that's kind of where I'm at with it. I got a gut. You're just going to see that in a little midi. It's going to be cute. Got a high waist, tights, and we're going to go. That's where I'm at with that. So.
Oh, that's beautiful. I felt like you're appreciating. Thank you. Thank you for sharing all of that. All of that. Yes, Dania's snapping. Dania, did you want to jump in? Because I know that you developed lymphedema as a child as well. I'm sure it's been a tough journey.
Yeah, well, for me, I developed lymphedema from birth, so it's something I always had. And growing up in Jamaica, I mean, it was hot, so I'd have to wear shorts and stuff, and people would stare, and it used to hurt a lot. And then I got into baseball caps, so wearing the baseball cap really low and holding my head down, not looking at anyone in the eye or anything. But then it was when I think I was about 16. I was walking in the underground. This is in London, staring, and I just stopped and said, "Why don't you just take a picture? It will last longer." And then since then I just didn't care. So it's like if I'm hot, I'm gonna wear shorts. If I see something I want to try on, I will try it. And I'll just go for it because at the end of the day, I have to live this life and it's my body. It's up to you to have a problem with it. But for me, I'm happy the way I am because that's how God made me. So yeah, so sometimes I think I'm blessed in the fact that I didn't develop it later on in life, that I grew with it. But it's still a hard journey, but it's one that I will take every day, one step at a time, one second at a time, because God doesn't give you more than you can handle, and it's just how you put that out there in public that will help, and it will help someone else even if they don't have lymphedema. So what you put forward can just carry you a long way. So yeah, I completely agree there.
Angelique, anything to add?
Yes, actually, I wanted to add on to what Monique was saying about giving herself grace during this pandemic that we've been in. I was kind of along the same journey of learning how to give myself grace and not be so strict on myself. But through that, and learning to just start again and not being afraid to start again, not staying down, I learned to have to think outside of the box. And it's something that helped that we were in a pandemic for. So like things like trying to get physical activity in by playing basketball in the front yard, or trying to get physical activity in by going to a less crowded arcade and playing skee ball and the balls there, just trying to do anything that's fun and exciting in order to keep myself going. I spent 2 years in a physical rehab, and that's one thing that I don't want to go back to. So it's a thing of, okay, sometimes one thing isn't working. Sometimes we have things that come up in life that gets us off track, but we can start again and we can start something brand new. The fun thing about the disease that we have is that there are so many different modalities that help. If something's not working, we can always try something different, and they're always coming out with something new that we can try as well.
Berlange, anything to add to this one?
Absolutely. Self-care. Like Dr. Alexa said, it's not necessarily getting your nails done, or I journey a lot. And I talk to myself a lot in a way. I'm the girl who would go in front of the mirror and talk to myself and say, wow, you look great today. Or, put my leg up, as probably some of you can see that I'm kind of fidgety. I'm rubbing my leg. I'm speaking in my head. I'm giving myself, again, like you said, grace. I am speaking over myself. Time to time, I'll tell myself, or I'll look at my leg while rubbing it, saying, thank you for carrying me this far. The relationship between us has not been the greatest. Other people have rejected you, and I have as well. I'm sorry. I do that a lot, and it works. It works for me. And I'm all about affirming. Before I step out, some days I tell myself, okay, what are you going to choose today? Fear or faith? And sometimes I'm very bold with colors and how I wear my compression stockings. I wear one-legged, the brightest color ever. And when I see people looking at me, I'm just like, all right, it's on and popping. They're looking at you, give them a show. So I roll my shoulder back and I'm like, here I come. And the thing with me, I feel like if you own your truth, if you are confident enough, and if you laugh louder than the world, you will drown out their noise. And they have no choice but to love you. They're going to have to respect you because you are owning you. I'm all about self-confidence because I spent years being ashamed with my body. I've spent years crying. I know what it's like to be on the other side. I know what it feels like to feel like, okay, I am going to die, because doctors did give me just about 19. They told me by 19, I will no longer live because of my condition. So I'm like, I know what it feels. So right now, as long as God give me the courage and the strength, I am going to live boldly. I am going to raise awareness, and everyone is going to know about Berlange, the girl with Clipochinane. So sometimes I'll step out and people will be like, are you being revealed? I'm like, yes, I'm being revealed because of what I do. And on my Instagram, my photos, especially when I photograph my leg, I photograph it and expose it in a way where it's positive. You have no choice but to see that, wow, if she can do it, I can do it too. So, for me, I'm in this space where I am proud of where I am. And I'm no longer ashamed because this is me. And like Wava said, I am going to live in this body, and Monique as well. This is the body I was given, and it is for a purpose. I don't think God ever gives you anything that you cannot bear too much. So I'm like, whatever the purpose is, I am going to live it out loud, boldly, whether you like it or not. I am going to be me. Thank you.
All right. I can speak on this before we move on. I just want to say that I'm a lymphedema therapist. I encourage my clients to be bold and positive all the time. And it wasn't until I joined and started this project with Deborah and started talking to people like you guys who are showing up so big and bold and beautiful, where I was like, okay, I can do it too. And let me know, let you know that my toe is in the water. I'm doing it slowly, but there was a long time that I used to hide too. And my lymphedema is small L lymphedema. It's pretty mild, but always wearing long pants, never wearing colors, making sure that I was hiding, and no more of that. I just want to say to people like all of you who've inspired me to start stepping with my little toe in the water, like I said, but moving forward on it. And so thank you so much for how you guys show up so big and amazing and openly and authentically online. It is impacting lots of people, including me. So just thank you for everything you guys do. All right. Moving on to the next question, which is about equity in healthcare systems. Dr. Alexea alluded to it a little bit in what she said about when she enters the healthcare system, even with people she knows, her colleagues. Sometimes, often, we as women of color or women who are of size or any kind of difference, if you have a mental health issue, you are going to be treated differently, even just for your gender in some spaces. So I wanted to ask, Angelique, we'll start with you. I think you mentioned also that you do feel it impacted you. Do you feel that your first foray into the healthcare space to get your diagnosis of potentially was impacted by your size, your race, your gender, or anything else that you think?
Definitely, it was impacting. There were so many facets that were impacting me actually getting a proper diagnosis. One instance, a lady that I had went to had said to me that she felt like I was a pretty girl and I needed to go back and get my education. And I was like, ma'am, I already have my master's degree, but thank you very much. But there's this common misconception when you go into a doctor's office, I believe, as a Black woman, that you are uneducated and you don't know what you're talking about. A lot of times I've had to take the doctors the literature about lymphedema in order to let them know what I needed to get done, especially in the physical rehab facility that I was in for 2 years. I had a doctor look me right in the face after I had already received the diagnosis and tell me that it was not lymphedema. He said because of his age and how long he had been in the medical field, he could just spot by just looking at it that it was definitely not that. I've had instances where doctors refused to give me pain medicine, and literally one time walked out of the room because I knew where to go to get treatment. All I needed was a referral. But sometimes, especially if you go in as a Black woman and you know a little bit more than the person that you're talking to of a different race, it automatically becomes a battle between the two of you. Instead of actually focusing on the health of the patient, it becomes a battle of education, race, and sometimes even sex. You know, I've encountered all of it along this journey. And I believe that that's what took the whole 10 years to get a final diagnosis of lipolymphedema.
All right, who would like to speak next? I know this is a hot topic.
Well, I'm gonna go.
Okay.
So for me, the disparity showed up when I was younger, and I think it was just a lack of knowledge in the medical community overall, because they're looking for an old white woman that just survived breast cancer. You know what I mean? Like, that's what they were looking for. They're not looking for a little 12-year-old. They're not looking for a baby. You know what I mean? That they just weren't looking for that. So for me as an adult, though, I'm pretty clear when I go into the doctor's office what I need and what you're going to do. And all of my primary care physicians that I've had since I've lived in Georgia have been very like, you know more about this than I do. This is your body. You tell me what it is. I did all the research, listening to other lymphedema patients, going online, because initially, oh, you can't do surgery. There's no surgery for this. There's no this. There's no that, you know? And so it took me doing my own research, coming up with my own treatment plan, then presenting it to my primary care. And I'm like, I need you a referral for this. I need a referral for this. Who do you think I could get referred for this? And my primary care is very facilitating in that. So when I would hear, I did go away for treatment to a inpatient facility for like a month and a half. It closed down. It was in Tennessee. And I met that was my first time meeting anybody Black with lymphedema, a Black woman. And she told me her story. And she had had lymphedema for at least 30 years of her life. And her doctor just kept telling her she was obese, she was fat. And to the point where she was so debilitated, she couldn't walk anymore. And her 15-year-old son is giving her baths and stuff. And I just saw the breakdown for her through that. And I just was like, I can't believe in our time that this is what's going on. And then just being able to share in the community of Black women on with lymphedema and lipedema, just seeing the misdiagnosis, that's what made me speak out more and tell people you have to be your own advocate. And if that door closes, walk through another one, because there is going to be, I've referred people to my doctor several times because I'm like, hey, my doctor is cool. He's a low white Jewish guy. I tell him what to do, and he knows where to send me and write that referral and keep it moving. But for me, luckily, I haven't had that much fight, just because I go in there prepared, guns ready and loaded, and be my own advocate. So I'm like, this is what you're going to do. Thank you.
Dr. Gaffney, do you want to speak next as a doctor?
Sure. I'm living for the day when patients don't have to come in guns blazing, ready to fight and advocating for themselves, because sometimes I encounter this as a physician who actually does spend time and listen to patients. My patients are busy trying to get them to let's do the usual normal protocol, because you don't have to fight with me, but they're so used to fighting with doctors. But it does help to have a little bit of information, or to be able to give a provider a jumping off point. Sadly, we see this for women of color, and we see this for women who, or people, period, who may be characterized as overweight or obese. Like, you get to the doctor's office and it doesn't matter what you focus on. You know, you're there for a cold and they want to start a weight loss plan, or you have issues that might be associated with weight or complicated by weight, and they can't see beyond the weight to focus on the issue at hand. And so these are issues that more predominantly affect our communities because we tend to be heavier and we are compared to our white counterparts, and, you know, all of the norms may not be what is norm for us, or it may not be what is generally accepted in our communities. And so we need culturally sensitive providers, and we only 2% of physicians are Black people. So it really gets hard to find someone who can generally relate to you and can see you beyond, okay, here is just a Black woman. Here is, and I don't mean this in a not nice way, but here's a fat Black woman, right? They cannot see us beyond that. You know, there's already an assumption made, there's already a decision that this person is going to, no matter what I do for them, is not going to work, or all of their problems are solely related to their education, their diet, their this, their that, without even knowing anything about us, right? We just walk through the door, they see a person in a Black body, and a decision is made, and poor outcomes come as a result of that. So, you know, I'm so grateful that you all are not just educating yourselves, but that you're sharing yourself, your story, and your experience, so that other people can learn from what it is that you went to, so that somebody else is prepared and, you know, did their research, found the literature, an idea for, hey, doc, this is what I would like you to consider, or, you know, this is what I'm worried is going on with me. Can you help me figure this out? Or send me to somebody who will. Because the problem with our insurance system is that if you have a certain type of health plan, right, you're not allowed to self-refer. You can't just say, I think I need to see a physical therapist, you know, a lymphedema therapist, and a vascular surgeon. A patient can't make that decision with many plans. And if you don't have a open to listening, and, you know, willing to help, as opposed to having their own provider agenda, because sometimes we have an agenda as a provider, the patient has an agenda, and those things aren't necessarily in alignment. And so it's a huge issue. And, you know, we have to be prepared to not just fight in our individual doctor's offices to get what we need. We have to be willing to fight on a systems level and go to bat with insurance companies. We have to do this on a governmental. So, you know, these are the things that we have to be willing to take on. And it's in our sharing of stories our stories, that it brings it to people's attention, it brings it to the forefront, and then it increases the effort to get things done.
Wonderful. I just want to add one thing. We are all women who happen to live in the Western world, developing world. So developed world, Canada, US, UK. I just want to also add that the other layers that will come in here and in other places where everybody's Black is then class and also mental health. So if your doctor isn't used to dealing with those things sensitively or in a way that helps you, that can also affect you, even if when the doctor looks exactly like you. So just to, you know, in all fairness to the doctors of the dominant culture, so to speak. Guavalicious, I think you had your mic off. You wanted to talk? Open?
Oh, I was just saying, well, in the UK, you don't have, I was going to talk on the insurance or NHS. And with the NHS, you basically get what you've been given. You could always pay for it privately, pay for treatments and stuff like that. But it's so expensive, and a lot of the time it's way out of your reach. So you end up just having basic care. So for me, I have MLD done and I'll have bandaging done. But it's always a case of a first come, first serve basis. And if they can fit me in, or sometimes I was told that my leg wasn't bad enough, so I don't need to have intention done. And it's only where if I go in for an appointment and my leg feels really hot that they'll consider to have me in for intensive bandaging. And sometimes that really hurts because you go to these people for help and they don't listen to you. They literally don't listen to you. And then I just learned to do most of it myself. I use YouTube videos, other videos of other patients showing stuff, and then I do it that way. Um, and I've also been to the doctors where I saw a clinical nurse, and she basically I had to um, have my heartbeat checked, and she needed to put it on my leg, and I said, you can't use that leg because I have a stocking on. And then she said, oh, I've never encountered this before. You're going to have to come back without your stocking on. Then I said to her, I've had it done before. You can put it in other parts of the body. And then she said, no, you're going to have to come back without your stocking. And I tried to explain that that cannot happen. I have to wear it first thing in the morning, last thing at night, and then put on another compression to go sleep. But she was like, no, no, I know, I know, I know. But it was clear that she didn't know anything and she wouldn't listen to anything I was saying. And it became really frustrating. And I remember I was so depressed that evening, and I spoke to my mom, and then she was like, no, you need to file a complaint because the way that's not right. She should have listened to you, and she's not aware of what kind of mental space you're in at that time. So it's this whole front of them not listening to you. It happens everywhere, but sometimes I'm grateful that I'm here because in Jamaica there's nothing called treatment. But unless you're very lucky and you have a relative in America or you have a relative here that can send stuff for you or send you books and stuff like that to help you with it. Because when I was in Jamaica, I literally had no treatment, and I was allergic to mosquitoes as well. So whenever I got bitten, they would get really sore, they would bleed, there was pusses. My leg was so hard, it was so painful to walk. I couldn't wear shoes, or I'd have to have shoes made. Um, but it was my nan who had breast cancer that basically said that you had lymphedema, and she would send, whenever she came to visit, she would bring like E45 creams, and she would bring me the lymphedema book by Professor Mortimer and told me to read it and to practice my massages. So if it wasn't for her, I think some of that wouldn't have happened, but it was still really bad. It was terrible, and it yeah, it was terrible. And I mean, now it's a bit better because I don't have the sores, but I think now it's just a front of trying to get people to listen to you, trying to get them to hear what you want, what you're trying to ask for, without them thinking, oh no, the budget. And then when you ask about it privately, like, okay, is there a private option? Then all this option comes up, but it's still out of your reach because it's really expensive. So yeah, so I think that's where self-care comes in as well, because if you don't have that self-care basis and that research basis, then who knows where you will be? Because yeah, sometimes you have to think about doing it for yourself and trying to, yeah, and then trying to be your own physician in a way. But yeah, that's all I had to say on it.
Thank you, Miss Berlange.
Yes, I'm sitting here like, wow. For me, I gave up a long time ago because I just got tired. I can't be bothered every time. First of all, for me to get to the doctor, it takes Bisa, you're in Toronto. You know what it's like. You could wait between 3 to 6 months to see a doctor. And then when you go, even the way they welcome you, the tone is very condescending. It just, okay, what are you here for now? How can we help you? And then, like you all say, you try to tell them, but they just don't get it. And some of the things that I've been hearing is, oh, you're so thin. I'm not sure how you have lymphedema. What are you doing? What are you eating? What's your diet like? And, the last time I think I finally said, I'm done, I'm not doing it anymore, is I had an appointment. I went to see a doctor, a surgeon, or whatnot. And first, they sent about 3 students in the room, and they asked me tons of questions, things that they already knew because it was a referral. So I'm sitting there already frustrated, like, okay, you know what? I'm not doing this. And then by the time the doctor came in, he asked tons of questions again. Then the whole team went outside. Luckily, I was on it. So I'm like, I want to hear what they're talking about. And I literally heard them saying, okay, well, we're not sure, but this medication, we haven't tried it. We are going to suggest it to her. We're not sure if she have children and if she wants to have children, but we're going to suggest it regardless. And so I'm behind the door listening, and I'm like, this can't be happening. So by that time, when I heard them, making their way back in the room, so I got dressed. And at this point, I was already sitting there like, okay, I heard you guys. I'm not trying anything. I don't care what you tell me right now. I'm just not. I am ready to go. So when they came in and asked me again, how old are you? Do you have children? Do you want to have children? Well, this is what we're thinking. We're not sure if it will work, but this is what possibly can help you. So then I said, oh, okay, well, sounds great. Thank you. I'll think about it. I got all the information, and that was it. Ever since then, I said to myself, I do not care how I am feeling. Even when my leg, time to time, my leg, I will get ulcers, skin ulcers. I'll just get wounds out of nowhere. But I try to manage that on my own. I don't tell people what I do, because I don't get in trouble, but I put some kind of medication on the wounds that my mom has been using since Haiti that heals the wound within a matter of a week. So that's what I have been doing. And going into the pool, I just learned how to swim during this whole pandemic. That's been helping. And I consistently wear my compression stockings. Every time I listen to my body. When my body tells me something, I just follow suit. If I need to rest, I rest as much as I can, 8, 10, 12 hours. If I need to stay in bed some mornings, I just feel like I don't even want to look outside, and I just don't, But in terms of going to the doctors and getting help from them, I gave up. When I'm online, I read what other people says, and I go on YouTube and Google, and I'm like, oh, okay. And what's frustrating too is when I see other people, like white people, saying, oh, I went to my doctor and it was great. This is what they said. I'm like, but why did they tell me that? Kind of thing. So I feel some kind of way, but I'm like, you know what? Whatever, I am going to manage. Luckily, it's secondary lymphedema. It's not as bad as in comparison to some people, probably you guys. So I've been managing just by wearing my compression stockings, keeping a not too healthy diet because I eat rice all the time. Okay. So I just manage the best way I can, and I live a life. But doctors, no.
I'm glad you're able to take care of yourself. I feel sad that it's come to that you're like, I'm not going there because they don't take care of me. And I think we as Black women deal with that, and anybody who has any kind of difference, particularly from the practitioners they're dealing with, especially somebody of the dominant culture, otherwise known as white. It's pretty sad, and the level of unconscious bias and how it impacts all of us, anybody with a difference. All right, but let's wrap this up because we're almost at the end. On a higher note, I'm going to ask a question that I want all of you to respond to, and I'll start with Angelique, and I'll call your name when I want you to speak. So if you could go back in time to a time when you were really suffering, the worst place possible in your memory with your condition, and you could talk to yourself now from where you are now and give advice in one sentence, what would you tell your younger self, your less healthy self, less attuned to your body self, that would help them make it through and get through? So,
honestly, I would tell my younger self and all of this journey's self, don't give up on God. Honestly, do not lose faith. Don't let these things that are coming about and kind of attacking your body, attacking your mind, attacking your emotions, don't let them interfere with your relationship with God. Stay focused right there and allow Him to see you through this, because there is a better day coming. You said one sentence, sorry, but I had to testify to myself.
right, Monique?
I would say to myself, you are worthy. Through worthiness is where I found my passion to fight and to live the life that I want, and not to succumb and make lymphedema define me. I don't want to be Monique with lymphedema. I just want to be Monique that so happens to have lymphedema. I don't want it to ruin my life. So just knowing that I'm worthy of all the gifts that God has for me.
Amen. Amen. All right. Dania, Guavalicious.
I would say to my younger self, I would say you're beautiful and you're not the girl with the big foot. You're the girl with lymphedema who is beautiful, and just let your light shine because that's most important right now. And loving yourself, that you should just love yourself no matter what. And if you want to cry, it's okay to cry because we just pick ourselves up again and just go again. And our story will be an inspiration for someone else. That's what I'll tell my younger self.
Beautiful. I love that. Dr. Gaffney.
All right. I would say to my younger self, you are enough. You have enough. You do enough. And that everything that you need is, within you. I've always been team too much. I've always been doing the most in every area of my life because I just, had this idea that I was not enough and that I can't overcome the obstacle. All are enough, and we all have what it is we need to conquer the things that we are going through. We may need to look outside of ourselves for knowledge, information, inspiration, motivation some days, but we have what it is that we need within us. So you are enough.
Beautifully said. Thank you. Berlange.
Listen, I would say so much. But I'll say you do not have to shrink yourself in order to be accepted. Dimming your light will not help you live out your purpose or your potential. And healing is revolutionary. And yes, you are enough.
Gorgeous. Okay, what I will add to that ties into what Berlange said. Hiding yourself makes your world small and your life small, and you are so much better than that and worth more than that. And when you are authentically yourself and you show up that way to the best of your ability, your tribe will come and you will be more than okay.
Yes, be you, be revealed, live out loud.
All right. We're going to close here. Thank you all so much for being on here with us today. All my panelists, I'm so appreciative of you that you agreed to come on. We will definitely do this again because there's so much to talk about another time. But thank you all for watching and being here with us. Check out, you can follow Conversationally, of course. Then, of course, Chronically Moni. So at Chronically Moni, it's Monique. Angelique is at the Lippy Butterfly, if I got that correctly. Berlange is at Berlange, Bellenge. Dr. Alexea is at Dr. Alexea. And Dania is Guavalicious87 on Instagram. All right, that is it. Please take care of yourselves and have gorgeous days. And thank you again for tuning in. Bye-bye.